Hi, I am Begüm Seyhan. I am studying mechanical engineering at the Faculty of Engineering at Ege University. I am doing this presentation for Introduction to Nanoscience and Nanotechnology. My instructor is Dr. Lütfi Altay. My topic is Nanotechnology in Health. The discovery of the new properties of nanomaterials and development of new science on nanomaterials lead to the new nanoscience and nanotechnology. At present, the nanotechnology becomes the real applied technology in daily use. It's accepted that nanotechnology is very useful new technology at present. The impact of new nanotechnology can be seen on several activities. Since the new technology is around us, the impact of the new nanotechnology to our health can be accepted and becomes the important consideration. Nano, very small size. In science, it means 1 billion of something, thus a nanometer is 1 billion of a meter. A nanometer is about 3 to 5 atoms wide or so, approximately 40,000 times smaller than the thickness of a human hair. Using an electron microscope, a Canadian microscope specialist called the world's smallest gingerbread house, replete with a sharply defined brick chimney, windows, and door. What will we talk about? About nanotechnology, nanotechnology and medicine, synthetic DNA, dry eye syndrome, nanorobotics, cancer diagnosis with nanomagnets, nanotechnology in cancer treatment, nanodrugs, monitoring of stem cells, reticulocytes, nanopancreas. About nanotechnology. Nanotechnologies are the design, characterization, production, and application of structures, devices, and systems by controlling shape and size at nanometer scale. Substances exhibit different behaviors, even extraordinary behaviors in nanoscale. Materials that do not conduct light and electricity under normal conditions may have the opposite properties in nanoscience. The first scientist to mention that nanoscale works can be done Richard Feynman, who was born in America 1918. Nanotechnology and medicine. Nanomedicine is a branch of medicine that applies the knowledge and tools of nanotechnology for the prevention and treatment of diseases. Nanomedicine involves the use of nanoscale materials, such as biocompatible nanoparticles and nanorobots for diagnosis, delivery, sensing or actuation purposes in a living organism. What for? The ability to manipulate structures and properties at the nanoscale in medicine is like having a submicroscopic bench on which one can handle cell components, viruses, and pieces of DNA using a range of tiny tools. Aims comprehensive monitoring, control, construction, repair, defense and improvement of all human biological systems working from the molecular level using engineered devices to ultimately achieve medical benefits. Perhaps one of the simplest medical nanomaterials is a surface perforated with holes or nanopores. To explain a few, carbon nanotubes, graphene single carbon atom sheet used for DNA sequencing, single-walled, tiny hollow, Rhodes-1 atom thick wall, show extraordinary optical, mechanical, thermal, and electrical properties, are being used to produce lightweight and extremely strong materials, which enhance the capabilities of devices such as sensors, provide a novel means of drug delivery with better specificity. Liposomes. Small, less than 200 nanometers, spherical vesicles composed of lipid bilayers surrounding aqueous inner phase, used to encapsulate active drugs and to target specific sites, cancer cells. Liposomes fuse with the cell membrane and deliver the molecule. Nanoshells. Nanoshell is a type of nanoparticle with a dielectric core and a thin metal outer layer. It means gold. 20 to 115 nanometer size. Applications: treatment of severe periodontal and other infections targeting killing cancer cells, soft tissue welding, and targeted drug delivery. Once the tumor cells take them up by applying a near-infrared light which is absorbed by nanoshells, it's possible to generate intense heat to selectively kill the tumor cells, sparing the neighbor health cells. Synthetic DNA. Japanese scientists created artificial DNA for the first time in 2007 with the help of nanotechnology. First, they created the skeletal deoxyribose skeleton. They placed 4 different artificially obtained bricks of this skeleton. Artificial bases were joined to the deoxyribose skeleton with acetylene bonds. When the DNA chain thus obtained is combined with another chain created in similar way, the typical double helix structure of DNA is created. Dry eye syndrome. The new invention, which will reduce the treatment of dry eye syndrome that causes eye damage, requiring the application of cyclopolyrin A substance 3 times a day to the eye once a week, will significantly reduce the amount of toxic substance that the eye is exposed due to excessive drug use. The nanoparticles stick harmlessly to the eye surface and use only 5% of drug normally required. Shangi and Sandy Liu of Canada Waterloo University Engineering Faculty was the idea of nanoparticles. Liu, who continues to work with him, shared this information with the medical world on the university's website. Nanorobots. Very small structures are needed to perform micro or even nano-scale tasks such as checking chemical events inside the cell, detecting or repairing damaged structures, moving the necessary materials into the cell or removing it from the cell. It's not possible to intervene in the cell with the large materials we have. Nanorobots are 1 to 100 nanometers in size and consist of several different atoms. The most widely used atom in nanorobot construction is carbon atom. When the carbon atoms are lined up like diamonds, the nanorobots are very robust. In addition, hydrogen, sulfur, oxygen, fluorine, and nitrogen are used. In order to allow them to move easily in the blood and pass easily through the capillaries, it will be appropriate to be in the form of a spray and to be given to the body through the vein. Thanks to blood circulation, they can quickly reach all organs and tissues. It's necessary to protect nanorobots from cells and antibodies that attack all foreign molecules that enter the body. Smooth and rounded surfaces, small volumes, and the ability to perform tasks in a very short time will greatly protect nanorobots from cell attacks. Thanks to sound waves with a frequency range of 1 to 10 MHz, acoustic messages can be sent to the robots. Thanks to nanorobots, it aims to send the necessary chemical substances to every desired part of the body and even to every cell. Cancer diagnosis with nanomagnet. Magnetic nanoparticles are a kind of intelligent nanomagnetic material with small particle size, light specific surface area, magnetic response, and superparamagnetism. It's possible to diagnose cancer with iron oxide nanoparticles with supermagnetic properties. Thanks to the superior magnetic power of these particles, the location of tumor tissues can be determined. Iron oxide nanoparticles into antibodies or killer cells collected in the tumor tissue send out magnetic signals. The signals are detected by a 1.5T magnetic resonance device. Nanotechnology in cancer treatment. One of the biggest restrictions in cancer treatment is that drugs act on cancer cells while damaging other healthy cells. Studies on treatments that will only affect cancer cells have yielded positive results in recent years. Thanks to special carrier systems developed using nanotechnology, it's now possible to apply treatments that do not affect healthy cells but kill cancer cells. In cancer cells treatment, particles of 10 to 100 nanometer size are used, which easily circulate in the blood and reach all parts of the body. The desired drug can be placed in these capsule-like particles. Nanocapsules are administered intravenously to the patient. Capsules that come into contact with the cancerous tissue are taken into the cell by a suction process called endocytes. In standard drug therapy, some of the drug that enters the cell is extracted immediately by special intracellular proteins.
So a nanoparticle is in essence a small package made out of little tiny molecules that can contain a drug inside of it. And that allows us to send that package to different places where we want that drug to go.
Dr. Yolanda Colson is an associate professor in thoracic surgery at BWH. She's one of several physicians who use nanoparticles to kill cancer cells. Her focus is on lung cancer. Her colleague, Dr. Omid Farakazad, runs the Laboratory of Nanomedicine, focusing on the use of nanoparticles to cure prostate cancer.
So we're able to engineer nanotechnology for cancer application that can identify these differences between a normal cell and a cancer cell and specifically kill the cancer cell while leaving a healthy cell alone.
These nanoparticles travel the same pathways in the body that a tumor cell takes.
The nanoparticles we've now developed basically carry a chemotherapy drug inside them and are able to recognize a cancer cell, bind to the surface of the cancer cell, get internalized, and then once inside of the cancer cell to release that chemotherapy drug over an extended period of time.
Then we can concentrate our drug, use less drug at that site, have less side effects, and not deliver it to places we don't need it. After surgery and the large tumors have been removed, it's really to prevent recurrence, either right at the site of the surgery or within the lymph nodes, which are the most common local areas of getting tumor back.
Dr. Colson says nanoparticles' usefulness extends way beyond treating lung or prostate cancer.
There's no reason that it wouldn't work in all cancers. It just would probably depend on us changing how we use it or working at a way to make it target specific tumor cells directly.
Nanoparticles are also being used to determine the course of disease by pathologists like Dr. Massimo Loda, who runs the Loda lab at BWH.
The nanotechnology allows us to probe the tumor tissue for the presence or absence of biomarkers.
Biomarkers are the expressions of genes that a pathologist uses to determine a person's risk for certain diseases, like breast or prostate cancer. For his work, Dr. Loda uses a specific type of nanoparticle called a quantum dot.
If you're looking at tissue using quantum dots, you will see different areas of a particular tumor light up with different colors. And that gives us a wealth of information in terms of the expression of genes that we previously didn't know were there.
A nanoparticle cancer called IT101, developed in recent years, has started to be used in cancer treatment. IT101 has a complex structure and its diameter is 30 nanometer. This nanoparticle carrying the drug called camptothecin can stay in the bloodstream for 40 hours without spoiling. When the IT-101 comes into contact with cancerous tissue, camptothecin slowly comes out. The nanocapsule, which has completed its task after the drug comes out, breaks down into small particles. These particles are excreted through the urine without causing damage. Nanodrugs. The use of nanotechnology in medicine making goes back 50 years. Hatice, developed in 1965 to carry medicine, are considered as the first example of nanomedicine. Molecules placed in these vesicles, later called liposomes, are not affected by liquids in the external environment. Nanoparticle drug delivery systems are engineered technologies that use nanoparticles for the targeted delivery and controlled release of therapeutic agents. The modern form of a drug delivery system should minimize side effects and reduce both dosage and dosage frequency. Some nanoparticles and usage areas.
Many drugs require administration by injection because enzymes and acid in the gut destroy them. However, patients prefer to take medications orally as injections can be painful. This project, led by a team of researchers from King's College London, aims to enable oral administration of drugs that currently require injection, such as biologics, which are on the rise, by establishing a design blueprint for the engineering of drug carriers that can cross the intestinal barrier. These drug carriers are called nanoparticles and are based on particles with diameters equivalent to 1/1000th of the thickness of a human hair. Nanoparticles are normally unable to cross the intestinal epithelium, but when we attach special compounds to the surface of nanoparticle carriers, they're able to cross the gut wall. These identified compounds are called transport-enabling peptides and have the ability to move across the intestinal wall. The nanoparticles cross the gut wall by binding to receptors on the cell surface. Overall, the project hopes to move from injection to oral administration of medicines, and ultimately develop safer medicines that patients are more likely to take.
Monitoring of stem cells. Thanks to nanotechnology, it's possible to follow the cells in the brain. Thanks to some molecules placed in cell cultures obtained from the brain of animals, the behavior of these cells in the brain can be tracked. For this purpose, mark molecules are placed in the cells first. Dendrimer molecules, the between iron oxide, which acts as a magnetic donor, when placed in brain cells cultures, stem cells swallow them. These cells are then placed back into the animal's brain. Thanks to magnetic imaging systems, the pleasant behaviors of these cells can be monitored. Thanks to this method, the operation of brain cells and the structure of the brain will be more clearly understood. Respirocytes. One of the important developments in the field of nanotype is respirocytes created in a laboratory environment and resembling red blood cells. Respirocytes are nanorobots that, in terms of function, are similar to red blood cells, namely erythrocytes, and carry oxygen them. Respirocytes with a diameter of 1 micron can easily move in bloodstream system. A spherical respirocyte consists of 18 billion atoms. Moreover, respirocytes can carry 236 times more oxygen than same volume of erythrocytes. The gas exchange of the respirators can also be controlled by acoustic signals sent from outside. In this way, it's aimed to change gas at any time and in any place. In a way, it will be possible to stay under the water for 4 hours without breathing or to run at a very fast pace without breathing for 50 minutes thanks to the respiratory that will increase the lung capacity. These are red blood cells. Did you see the difference? The replica red blood cells look just like the real deal. Spot the difference. These are the red blood cells. Nanopancreas. Insufficient secretion of the insulin hormone produced by beta cells in the pancreatic gland leads to diabetes, causes uncontrolled rise of blood sugar, and damage the organs accordingly. Although there are also intense studies on the transplantation of pancreatic beta cells, there are very important difficulties in this method. Beta cells transplanted into body can be attacked and destroyed by immune system cells in a very short time. Doctor from Boston University, thanks to a new nanosystem developed by DSI, it's possible to safely send insulin-producing cell into the body. Normal life of beta cells taken from guinea pigs in the human body is only 1 minute. These beta cells taken from guinea pigs are inserted into the body by placing them in a 7 nanometer nanocapsule. The cells continue to produce insulin in the nanocapsule. Pores allow insulin and sugar to pass, but body immune system cells larger than 7 nanometer and antibodies secreted by them do not. When these capsules, which are not yet used in humans, are given to experimental animals with diabetes, complete treatment is provided. Nanotechnology has led to important developments in health as well as in many other fields. Nanotechnology is promising in preventing harm caused by medicines, which have an important place in disease treatment and in treating their diseases. Significant studies such as artificial DNA, nanorobots, cancer diagnosis and treatment, and nanopancreas show that this process will continue and develop. Thanks for listening. Take care of yourself.